So in the previous section, we saw how the layout of the CPT book and how what are the different sections. So it begins with the introduction, then there are various sections which are arranged in the numerical order, then there are different appendices. We didn't go very much into detail, but you had little bit of introduction about the various appendix, then we learned about the various symbol, and then we spoke about the index which is at the back of the book. So after seeing all that spread out of the book, let us use that knowledge and find out how to find out the code. Now, whenever you are finding out the CPT code with the help of CPT book, there are three main steps one must follow. One is you have to look up the main term into the index. So first and foremost is you have to pick up the main term from the given documentation. Then you go to the index, you find the main term in the index. Now you all know that the index is arranged in the alphabetical order. Then the second step is verify the code in the chapter or in the section. The sections or the chapter, they are arranged in the numerical order. And the step 3 is apply all the guidelines and the parenthetical notes to find out that exact code that will fit the documentation. So the first is look up for the main term in the index. We all know the index, how does it look like, and what are the different codes, like either there will be a range of code, or there will be a multiple code, or there will be a single code. And the index is arranged in the alphabetical order by taking the name of the procedure or the services or the organ or anatomical site. Now the second step is verify the code in the chapter. In the previous slide, we have seen the picture of the section, but here I'm going to go slightly into the detail. And here you will see that this particular thing is the section is a surgery, and then there is a subsection which is an integumentary system, that is here. And then you have the subheading, that is a skin, subcutaneous and accessory structure. And then there is a category, in this case it is an introduction and removal. So you will see like this in the section, and then there are codes which are written. You can have a look at the parenthetical note which are there, and then all the symbols which we have learned, that you will see everywhere all along the section, and you can apply the guidelines, you can apply those symbols, and it will be easier for you to understand that particular code. And third and most important is confirm that you have coded correctly by viewing the coding guidelines, modifier and other directives that apply to the code. So once you select the code, then you need to read the parenthetical guideline. Like for example, if you have selected the code 44705, I will read this parenthetical guideline before I will confirm this code as my final code. So reading the parenthetical guideline is at most important. Now let us take our first example. Dr. Ross decided to do the cervical esophagotomy on Mr. Jordan. So how do one find the main term? So we need to find out what procedure happened in this patient. So the procedure is esophagotomy. So this is the main term, and there could be sometime the subterm. In this case, the subterm is cervical. Now remember, whenever we are coding for the esophagotomy, there are certain procedures which are similar, because those are the surgical procedure that involves the esophagus, stomach and intestine, and they are esophagectomy, esophagotomy and esophagostomy. And we know what is the meaning of those suffixes. Ectomy is surgical removal, tomy is to cut into, and stoma is opening. So in our case, what happened is esophagotomy. So I'll pick up that terminology and go to the index. Under index, there is a terminology esophagostomy. But is that the thing that happened in our patient? No. In our case, the procedure that happened is a esophagotomy, and I found the multiple code 43020 and 43045, and then I'll pick up those code and go to the respective section. So we came to the sections which are arranged in the numerical order. So in that we are going to check 43020, 43045. So in this case, the 43020, it reads esophagotomy cervical approach, and 43045 esophagotomy thoracic approach. In our patient, it was a cervical approach. So I zeroed down my code as 43020. Now one more example. A 12-year-old Julia arrives to the physician office, who performed a comprehensive history and exam. The physician decided that the Julia needed a tonsillectomy urgently. The patient was taken to the surgery center and the physician carried out the tonsillectomy. Let us begin with the step 1. Step 1, check the main term in the index. What is our main term? Tonsillectomy. Because I am going to ask the question, what has happened to the patient? The patient underwent a tonsillectomy. Tonsillectomy main term, pick up the main term and go to the index. Now in the index, I am going to see everything with the word with the alphabet T, and I found the word tonsillectomy. Now in the tonsillectomy, in front of that there is a range of code 42820 till 42826. Pick up those code and then we go to the step 2. Now we came to the section and we are going to see each and every code. The 42820 code, it talks about the tonsillectomy and adenidectomy. In our patient, that did not happen. Remember, whatever is mentioned in the documentation, we had to be extremely careful only selecting that. So definitely tonsillectomy and adenidectomy, that didn't happen. So I am not going to select the code 42820. The 42821 code says age 12 or over. This is a indented code. So I'll be reading the above code language till the semicolon. So the 42821 says tonsillectomy, adenidectomy, age 12 or over. Definitely that didn't happen. So definitely don't select this code. Now pick up the code 42825. It says tonsillectomy, primary or secondary. That's what happened in our patient. But the patient age is younger than age 12. What is the age of our patient? Age of our patient is 12 years. So check the code 42826. It reads tonsillectomy, primary or secondary, age 12 or over. So this will be my final code. Jack came to the emergency room with a severe pain in the lower abdomen. Doctor advised appendectomy. So what is our first step? Look up the main term in the index. What is my main term here? What has happened to the patient or what procedure the patient underwent? He underwent appendectomy. Pick up that main term and come to the index. Appendectomy, and I have the code 44950, 44955 and 4496. So we found a multiple code in the index, pick them up and go to the respective section. So after picking up the multiple codes, we'll come to the respective section and then we will zero down our code. So the first is appendectomy. This code is 44950. The second code is the add-on code and it says when done for indicated purpose at a time of other major procedure. That did not happen. And 44960, it talks about for ruptured appendix with abscess or generalized peritonitis. Remember, whatever is given in the documentation, we need to only zero down on that code. If the documentation does not mention about the rupture appendix, we cannot pick up the code 44960. So after going through all the code, I can very well zero down my code and that is 44950. Let us take one more example. Jackson underwent deep soft tissue needle biopsy for shoulder. Now in this case, we need to find out what procedure has happened. So the procedure is biopsy. The second subheading is a soft tissue needle biopsy. So the biopsy can be of various variety, but in this case, it is a soft tissue needle biopsy. So what is my main term? My main term is biopsy. Under biopsy, you will have the biopsy of the various organ. So what I am interested in, the interested organ is a shoulder. So I am going to go down under the heading biopsy. I will look for the every organ. Kidney, is that my organ? No. Then leg, is that my organ? No. Lung, is that my organ? No. My organ is the shoulder and I can find out the code shoulder here and there are code which are written here. The code is 2300 65 and 66. So I'm going to pick up them and I will go to the respective section. So we have picked up the code and we came to the section. The codes were 23065 and 23066. The 23065 code says biopsy soft tissue shoulder area superficial. But in our case, the biopsy is a deep biopsy. What is the code 23066? It is an indented code. So I am going to read the biopsy soft tissue shoulder area because this is a common language because I can already see the semicolon and then I am going to use the word deep. So 23066, it is biopsy soft tissue of shoulder area deep. And so this is my final code. No, wait, but there is a step 3 here. Confirm if the guidelines or other directives apply. So I'm going to read the parenthetical note, and it says for the needle biopsy of a soft tissue, use the code 20206. So there was one more directive which was telling me this is not your final code. You need to go to the code 20206, because this particular code says it's a biopsy, it's a soft tissue of shoulder, and it's a deep, but it doesn't explain what is the kind of biopsy. And below that it is very clear cut note that if it is a needle biopsy, you need to pick up the code 20206. So come to the code 20206 and read biopsy muscle percutaneous needle. So this is what happened in my patient. So I am going to pick up the code 20206, and below that there are many parenthetical notes. If the image guidance is performed, we need to additionally add this code. But in our patient, there is no such mention. Remember, if in the documentation, if the doctor forgets to write anything about the patient or any detailed instruction, and if the doctor has not written, we cannot imagine. Whatever is written in the doctor's documentation, we have to code that. In this particular question, there was no mention of the image guidance, so I'll zero down my code as 20206. Now the next example, Reena had 2 hours of hydration via intravenous infusion. So ask the question, what happened to Reena? So Reena underwent hydration. So let's begin finding out our main term in the index. Under the hydration, there are 3 options. One is intravenous and the second is rehydration oral solution. In front of intravenous, we have a multiple code 96360 and 96361. So we will pick up the code and then go to the respective section. Now the first code 96360, it talks about intravenous infusion hydration initial 31 minutes to 1 hour. So what you have realized is that it starts from the 31 minutes to 1 hour. So the 96360, it covers the first 1 hour. Now in our patient, the hydration happened for 2 hours. So we need to add that additional hour. So if you see the code 96361, the code 96361, each additional hour in addition to the code for the primary procedure. So in this case, this is the primary code and this is the add-on code, and we will have to take the support of the add-on code because we have to code for the 2 hours. So we will write 96360 because it covers the first hour and each additional hour 96361. So my answer will be 96360 and 96361. Again, you have learned that we will never write the add-on code in the first place. There has to be the primary code. This is the primary code and this is the add-on code. How do I know that this is the add-on code? I can actually see the plus sign in front of the code. So we put all the guidelines into action and we pick up our final code, and these two are final code for this patient. Now next example, Dr. Ann Jonas perform a bilateral ligation of the femoral vein on a patient today. So now find out what is the main term. The main term here, it is a ligation. Ligation of what? Ligation of the femoral vein. Okay, so we will pick up the main term ligation and come to the index. Now here the word is ligation. Under ligation, it is a artery ligation and vein ligation. What is our substance? It is a femoral vein. So under vein, I will look for the code. What is the code? Femoral, and there is only one code, that is 37650. Easy, because there is only one code. So I'm going to pick up that code and I'll go to the main section. So what was the code? The code was 37650. So I'm going to pick up the code ligation of the femoral vein. Is that my final code? No. What was my third step? Read the parenthetical note. Now the parenthetical note says for the bilateral procedure, report 37650 with the modifier 50. Is in our patient, was it a unilateral or bilateral? It was a bilateral procedure. So this will be my final answer. 37650 and then modifier 50. Now the next example, Dr. Breverman performed a destruction of the trigeminal nerve by neurolytic agent into supraorbital branch. So here there is one main term, but there are many subterms. So we need to find out what happened to the patient. What did the doctor do? The doctor did the destruction. Destruction of what? Trigeminal nerve. Trigeminal nerve, or by what? By neurolytic agent, and which is trigeminal nerve supraorbital branch. So there are many subterms, so we have to be extra careful. So first we will find out our main term, that is a destruction, because that's what happened. Under the word destruction, there is a destruction of the cyst, destruction, fulgation, laser surgery, destruction of the vulva, and destruction of the nerve. Now under the destruction of the nerve, I am not finding any code because they are telling C nerve destruction. So this is pretty much like ICD. In the ICD, in front of the C terminology, we were not finding any code, and same thing happened here. They said C nerve destruction. So let's go to nerve now. So the under the main term now we are going to see now has ablation, now has biopsy, now has cranial, now have decompression, and now has destruction. So I found out nerve destruction. Nerve destruction by what? By neurolytic agent. That was my another subterm, neurolytic agent. Now which nerve it was? It was trigeminal nerve. So in that also you will see that all the nerves are arranged in the alphabetical order. So you will have celiac plexus, then you will have the other peripheral, and then you will have plantar, and then you will have pudendal, superficial, and then you will have a trigeminal, and you have the multiple code. You will pick up those codes and then you go to the respective section. So we are going to see all the three codes. 64600, it says destruction by neurolytic agent, trigeminal nerve, supraorbital, infraorbital, mental or inferior alveolar branch. So I very well zero down my code, and my code is 64600. So this is my last slide, and from all this example, I guess you got enough hint how to look for the code. Remember, always go to the index first. Though in the index, sometime you might find only single code, but do not stop at the index. You have to go to the main section and find out if there are any parenthetical notes, and then only you finalize your code. So this way now you are very well aware how is the layout of the book and how to find the codes from the book. Now the next my lecture is going to be from the on every section. So the first section is going to be anesthesia.